Hi, I'm Dr. Kathleen Carson, and I'm here to discuss with you oral appliance therapy for your obstructive sleep apnea. So, if you have been diagnosed with obstructive sleep apnea, it may be recommended that you use an oral appliance to help treat it, a dental appliance that holds your jaw in a slightly down and forward position, helps you keep your mouth closed. Because obstructive sleep apnea, if you view it as a kink in a hose, and your airway is that hose, you at some point during the night have a kink that stays closed and shut for 10 seconds or more, and it results in a drop in your oxygen level in your blood that can be harmful to your overall health and contribute to many systemic diseases. So we're trying to unkink that so that your body can breathe better, your brain and the rest of your body can get the oxygen it needs to recover and heal at night. So with mild to moderate sleep apnea, oral appliance therapy can be a first line of treatment if your medical team has deemed that that's an appropriate choice. So you may be getting your appliance for that reason and never have had to try a CPAP. For other people, you may try a CPAP and not tolerate it very well, and you may be recommended to use an oral appliance instead. So that's another group of people that may be starting oral appliance therapy. A third group is if you're maybe more moderate to severe, when that airway hose is kinked shut. The way a CPAP will work is you're turning the volume up on that water, right? Where it's the air in your case, and we're blowing through that kink to open it up. And depending on the degree of that kink, that airflow might have to be really, really high. And if that's the case, sometimes people have a hard time tolerating that. They get gas in their tummy, they open their mouth and poof, it's like an air tunnel. It disrupts their sleep. They're really uncomfortable. So if you add in an oral appliance, what the oral appliances do to that kink is it just kind of loosens it up a little bit so that that water or that air, in your case, can flow through better. So for those patients that have moderate to severe, maybe that oral appliance might not open it enough to completely let that flow go, but what it will do is it'll let you turn down that volume on that hose. So when you combine your PAP therapy with the oral appliance therapy, you tend to be able to tolerate both better and get better results. Other people like to wear the oral appliance when they travel, or maybe alternate between the two because sticking with one isn't really realistic or working for them. So there's a lot of different reasons you might be starting your oral appliance journey. There's a number of different oral appliances that are out there. In general, one should be picked to fit your specific needs, your dental anatomy, how it's going to best stay in your mouth, be tolerated by your jaw joints and your bite. There's a lot of factors that your trained dentist will need to consider when picking one. It's not a one-size-fits-all. And that's why if maybe you've tried an over-the-counter version of it, you might not have been super successful because it probably wasn't really designed to be the best fit for you. They tend to be bulky, try to encompass a lot of things, create more problems than maybe they help. Some people get some results with them, and that's great. But if you aren't one of those people, don't be discouraged. A custom-made one that's fit specifically for you and your needs, both your level and degree of sleep apnea, why you might have sleep apnea, because not everybody's the same, and how your bite and body functions. If you really get that looked at and get one custom made for you, they really can be very tolerable, very effective, and we've had quite a few people have great success with them. So watch my next video on the different appliances that you may be getting and what the delivery process looks like so you can be prepared.